About blockchain and healthcare. So this is really kind of an interesting process in terms of how we're going to try to address healthcare. As the patient is really the central point of the whole healthcare ecosystem. There's a reason why this industry even exists. And we do have a right to accurate information. And again, it can be looked into as a matter of life and death. And I've got a really clear story on my part is I'm a big fan of multi-care. I like multi-care clinics. So when I went to go to a multi-care clinic, they asked me how my diabetes was. And I don't have diabetes. But what they did end up having happen was they mixed my record up, my visit to that clinic with another person that lived way north of me and kind of confused the two people. So that's not good, right? Because that could be life and death. If they were treating me for something I don't have, like diabetes, you can make a lot of really bad medical decisions based on that. The good part is that I was awake and I could tell them that, no, you have the wrong person. The bad part would be is if I was in an ER and I had been in a car wreck and I was unconscious and they were treating me like I had diabetes, a condition I do not have. So you can really get into a lot of trouble if your medical records are not accurate or something happens. So the privacy and security of the health data is really important because I also don't think I needed to know that the guy that lived north of me with my same name has diabetes and that it's basically not well under control. So as we moved away from paper record keeping and going into other kinds of technology, including blockchain to store patient data, keeping it confidential can be really kind of problematic. And that's outside of the accidental data breaches, like wanting to know how my diabetes is doing when I don't have diabetes because you've gotten me confused with another patient, right? So the patient can be given a number key or access to these records, and then I could authorize release on the time. And if you take a look at it, really what's being proposed is much like what we use for the passport system, right? The RFID chip inside your passport basically points to a database entry inside of government space where they can go ahead and they can pull up everything that needs to be done for that passport. Passport really is just a pointer to a government record. You could do the same thing with either a number or a blockchain or something else. That would be essentially the same kind of service. So that's a base technology that we could use. But right now, the healthcare system is extraordinarily fractured and extraordinarily stressed at the time of recording of this. COVID has really shown us where we can improve the system. And again, nothing against anyone working in healthcare. COVID has really shown us that there's some definite issues within the supply chain for healthcare, within the support system for healthcare, within patient information, record keeping in healthcare. There are improvements that can come. Now, these improvements will not come from the entrenched systems, right? There's literally no point in trying to get an entrenched system to try to improve on this, right? Rather, what you're going to see is you're going to see some changes come through regulation. You're going to see some changes through customer demand and customer spending habits, customer requirements, and then the ability to show cost savings, whether that's to a board or whether that's to a group of stockholders. There's some real potential cost savings by going to blockchain or even just an incremental improvement in how we manage data inside of the healthcare system. Now, we spend a crazy amount of money in the United States on healthcare. We spend almost as much money on healthcare per person as we do on each student in K through 12. So right now, based on the data I was able to find, in 2020, we spent $12,530 per person on healthcare. That's over $1,000 a month. We spend about the same amount, $12,264 on each student in K through 12 annually. So over $1,000 per person per month is going on in healthcare. And if we could save that, some of that, any part of that, there's some real amounts of money that can be saved. Now, another way of looking at that is on a global basis in the per capita by global spend. So we're the green dot. The United States is the green dot there, and we are way off the control marker, right? We are way off that trend line. So on average, by per capita, each American earns about $64,000, and that's the midpoint, right? That's our midpoint grade on this one. So by stats, we spend about $11,000 or just a little under $1,000 a month. So it pretty much matches the other data set. So what are we getting for that? We need better systems. And again, COVID has really shown us where those problems lie, especially in the data side of it. So we're not going to talk about things like for-profit healthcare, nurses' pay, staffing, or anything else, but the underpinnings of data, there's a lot of neat things that we can do there to get us back on track. There's some savings in the data, and there's other ways of fixing things inside of data standards that we can actually do. Now, blockchain is just one solution. It's not the full solution. It's not anything that we're not already doing, but it can really solve some serious interoperability issues. Blockchain can, especially such as care coordination, data security. right? Every day, the healthcare industry is generating a ton of new data, medical records, laboratory tests, results, billing, clinical trials, and remote monitoring, and other things. So often this is trapped in just databases. It's just trapped, or it's taken a look at and ignored. So when my mom was in the medical ICU for her heart, they had her strapped in, and she had oxygen and heart rates and all these other things. So they were getting more data off of my mom every minute than you would get off a launching of a rocket. So the cool part is that all that data was then being sent to the nurses station and then being sent to a third-party monitoring. So if the nurses weren't there, you had a backup monitor, a third-party monitor in India that could then go ahead and page a nurse locally so that they could actually go and see what my mom was having problems with. Now there's some delays in that data system. There was one point where my mom's heart stopped, and then we asked, Mom, are you still with us? And her heart picked back up again. So little glitches in the data, things that happened along the way. We're not really sure if Mom's heart really stopped or not, but no one came running in, nothing alarmed out. It was just kind of one of those things, right? But whatever happened to that data could have been kept, that data could have been chopped, could have been dumped, anything. We don't know where it went. We don't know what happened to it. Now, blockchain could harness that data stream, though, and actually give us pointers to records or databases or anything else. So that data could then be used by her attending physician back where she lived. And it could have helped, protect that data from hackers or giving patients more control over that data. Maybe Mom didn't realize her heart had stopped and wanted to take a look at that data, or her attending physician wanted to take a look at that data, or primary care physician. And otherwise, so we know the data was clean, we know that it wasn't hacked, and we know that it was pretty accurate, that her heart stopped on multiple occasions while she was in the medical ICU. Right? Blockchain could have kept all that record for her. We don't know where those records are. We don't know if they were kept or if it's just dumped in the bit bucket after it had been monitored. Right? So blockchain technology could have aggregated that whole process of my mom being in the medical ICU for your heart by the prescription she was given, what the doctor's notes said, what the telemetry was saying, what the nurses were saying, and all the other things that happened to really just generate that single up-to-date record, which her attending physician or her ER physician or anyone else that was looking at my mom as a patient could have referred to when treating her. So again, it all could have fit into blockchain. It all could have worked, especially if it was just a pointer pointing off to a database that had the data in it. So interoperability is huge, and that's where blockchain could really shine on this whole process, the interoperability of electronic health records, which could allow providers to access medical histories. And again, for me, getting me confused with someone else, some other patient with a similar or same name, asking about my diabetes, that might not have happened with this system if we had had a way of proving who was who and making sure that the records were the right records, right? Providers could access a patient's medical history. Say I'm teaching in New York and something happens and I have to go to the hospital. How are they going to pull up my medical history? I'm nobody in New York. No one knows me there. They would have to be able to pull in my records from Seattle. If you had one way of doing it, that would really work. So there's a couple of studies that if you had full nationwide interoperability, because we do go on vacation and accidents do happen, you could save the healthcare system about $77 billion per year. That's not small amounts of money. That's money you could reinvest back into treatment and care. The other one was interesting, was supply chain integrity. So we know that fake drugs end up on the market. We know that counterfeit drugs end up on the market. You see this a lot, especially among really super expensive drugs, cancer therapies, genetic therapies, and other stuff, where you get counterfeits in that supply chain, and it can be brutal for who's ever supposed to be getting that treatment. Drugs get watered down. So the supply chain integrity for those super expensive drugs can really be important, especially when you get into how they're manufactured, who the wholesalers, pharmacists, and then patient. So IBM, especially using their hyperfabric, treats this like a producer to consumer event, and it could reduce the incident of counterfeit drugs. And the estimate on that one is $200 billion in annual losses due to counterfeit drugs. That's a lot of money you can sink back into treatment. The other one is drug development. I think as we move into the new era of drug development, machine language, AI modeling for chemicals, peptides, genetics, all the things that are going into modern drug development, you're going to have some really interesting processes, because what we're finding out is that patients by race, by gender, by genetic makeup have different results. And you can get those patient results more widely accessible to researchers or to doctors if you had that data being recorded from the minute you went through the time trials or the trials for those drugs all the way through. right? So they say that, there's certain drugs you don't eat grapefruit on. There are certain drugs you have to watch out for if you're pregnant, and others. There are other drugs that cause some really interesting neurological changes that could lead to suicide among certain types of people or certain groups of people. So again, in drug development, if you can have that kind of information really super handy, that would be great. And then in smart contracts, the cool part about that is if you go into smart contracts in healthcare, as long as the conditions are met, and then boom, especially if you could automate it, the health insurance company could pay the provider, set fee, arrange however you want to do your payment system inside of healthcare, which looks like black magic more often than not, especially with the insurance providers. As long as something is done that's linked to a specific profile, that's linked to a provider, you can make sure that everyone is correctly paid for whatever service is rendered. And you can pre-negotiate all that stuff with whoever the insurance agent or Medicare or Medicaid is. So again, just neat things, right? So there's some challenges, of course. A lot of them are going to be based on a guy named Tim Aviv, which really took a look at how blockchain actually was working in healthcare. So we really do have a massive duplication of data. So every time you go into a doctor's office, what's the first thing they do? Yeah, have you fill out your personal information, a HIPAA form, why you're there, how you feeling, mental status reports, all the other things, those standard reports that you do every time you walk into a doctor's office. It would be great if I only had to do that once and then maybe update it if something changes. But odds are highly likely as you go through time, not a whole lot of that data is going to change. So we do that every time we walk into a doctor's office. If we could just say, yep, same as last time, we'd be good to go. Take away for that massive duplication of data. If the doctor could just bring up what my last initial patient survey looked like, has anything changed? Nope, good, boom, move on. Saves time, saves money, saves effort, saves pain on the part of the patient. I don't have to arrive 15 minutes early to fill out paperwork. Right? So a potential solution is that looking at what Estonia did, right? The government did a government-based blockchain initiative, which allowed companies to create their own solutions on that ecosystem for healthcare innovation. However, the public blockchain does not mean that the information is going to be open to everybody. You do have regulations around privacy. Not everything needs to be public. If I have an HIV status, if I have a STD status, we do not want that public. We really don't. I just want it among certain people, not everybody. There are things that my family doesn't need to know about. So there you go, right? So we can secure data depending on how socially weird it can be for the person having the problem, right? Another technical challenge for blockchain is HIPAA, privacy regulations, GDPR. There's some GDPR components in here, and keeping that distributed across the network. Right now, what's being looked at as probably the most interesting solution is much like they use for passport systems globally now, which is your passport contains an RFID chip that points back to a pointer to a database that then, boom, you can go do. And that chip could be inside your payment processor card, so you get the little card from your insurance company. That could just be it. There you go. You just pop that little card right on the reader, and then there's all your data. So you have that, but then the big thing is making sure that the data isn't compromised or taken over by hackers. So we got to understand that data breaches happen, traditional systems and non-traditional systems, hacking happens all the time. So we need to make sure that if we do have something like that, where can we prevent disastrous data loss because of blockchain-based solutions? Part of the glory of the blockchain is that it's really hard to change data inside of it once it's there. So Hipaa and Blockchain. Right, using a blockchain medical service provides access to storage of reliable data, but all that data has to be fall under HIPAA, and I have to agree to release it. Now, the interesting part, though, is that when we go into the doctor's office, we sign our little HIPAA release form, and much like we see in education, there's your loophole. All right, as long as that data has been released, it's been released. You can't control it once it's been released. So while patients will receive their medical information from the institution after the visit, you've signed that release, and the lab has got it, your physician's got it, people who have access to your account have got it, the hospital could bring it up, or wherever it needs to be used. It's all there. The patient could verify the institution and send it back saying, yep, that's my doctor, yay or nay. So you could put a human in the loop to go ahead and agree to processing, or you could have it more automated using a smart contract. Dan signed his HIPAA compliance form that gave authorization to third-party agencies to access that medical record from that visit or all visits through this organization, and call it good. You can absolutely pull the human out of it by just doing a smart contract. So Hipaa and Blockchain. So there's a guy did some good research on it and really saw blockchain as an opportunity to exchange information between interested parties and protection of the patient's privacy. So again, it's that whole idea of using a smart contract process and going ahead and using the loophole for FERPA like you would with HIPAA and moving forward on that. So if you have a loophole on one federal reg like FERPA, you can use that same loophole. Odds are highly likely for HIPAA as well. As long as I've signed off on it, boom, you're done. You could use an identity-based encryption. You could use a smart contract. You could do electronic signatures. There's lots of ways of approaching this. But the big thing right now, and the problem that we have right now, is there's no one central area to concentrate that blockchain on. We still have silos. And that's really where the next big challenge is going to be. It's going to be breaking down the walls. So where are we at then? Right now, we're centered on privacy, confidentiality, availability, and the age of the data. There is data that is no longer valuable over time to the specific patient, but may be more interesting to people who are doing research studies. So like my mom's entire telemetry for the 10 days she spent in the cardiac ICU is of no longer relevance to anybody at this point, but it may be relevant to people that are doing research on 87-year-old women in cardiac ICU, and what does that string of telemetry look like? So you could archive that data off into Glacier for research if she agreed to participate in that. So again, the age of data and the usefulness of the data are going to be interesting. So who's in this space? There's actually a lot of people that are in this space. So IBM, and IBM is using the same hyperfabric process that they do for food, they do for medical. So it's basically a consumer to producer chain. So the producer will make a drug or a thing, and then as it goes through the supply chain, it's marked and labeled all the way through to the consumer to make sure it's an authentic product. They're more centering on credentials, suppliers, and safety. But your medical records outside of that consumer to producer for drugs or a product or something else really are cornered on the two big systems for storing patient records right now, Epic and Cerner. So Cerner is interesting. So Cerner was just recently purchased by Oracle, and they've had some complications in terms of being able to meet requirements. They're set by regulation. So there are going to be some complicated and future growth for aspects of the medical records company until Oracle's purchase gets sorted out. Oracle is going to do some changing. Every time you get a company bought out, they always do. What is interesting is that Cerner actually has an open API at code.cerner.com. It's available, but on inspection of that and looking through the documentation, looking at job descriptions, there's nothing obvious going on in blockchain right now. They have an open API, but there's nothing going on in blockchain that I was able to discern or find out. So there's a big data pool that if you can get access to it through that code, you may be able to do something interesting with it. And then there's Epic. Now, Epic is really the big person in town. So depending on whose research you follow, they're either used by 45 to 54% of the entire health population in the United States. So there's a huge opportunity for Epic to re-image healthcare and re-image data sharing. But there's nothing on the website, in literature, or in job descriptions to indicate anything blockchain is even on the roadmap for the company to pursue. It doesn't mean it's not there. It just means it's not public right now. So there isn't even an indication of a public API like Cerner. It's still pretty black box. Doesn't mean that there's not a way around this. It doesn't mean it's not there. It just means that from that Epic viewpoint, there's really no clear indicator that there's anything blockchain going on with that storage system. But there are people like Kaleido that are doing turnkey processes where companies can build their own solution upon the platform. So Kaleido, much like IBM, is really doing blockchain as a service, right? So it's an interesting concept, but the thing that makes this even more interesting outside of what IBM is doing is that they have a full API. You literally build using their building blocks, and you can make your own dashboards, and it's a really click and go network. So you could actually probably tie things into CERN because of the open API, and possibly Epic if there's a way to get to their stuff programmatically. Now, Epic has dashboards, so that means there's an API in there somewhere. I'm just not able to find it in the documentation. So Kaleido basically is kind of offering that support system underneath that whole process, much like IBM does. But Kaleido just seems to be a whole lot more user-friendly when it comes to this. So we can get better interoperability. We can do some legacy systems processing, patient data protection and traceability, as well as payment processing along the way. That if you can just go ahead and plug and play, you could use a system like Kaleido with blockchain as a service, which is interesting in its own right. and go ahead and do the things you need to do to come out with some really interesting solutions for healthcare and using blockchain. Really worth looking at and seeing where this company goes in the future. So Kaleido is the build upon the platform, right? So they're going to create and customize your blockchain network in a fraction of the time, a fraction of the cost. So again, cost savings and all the rest of it. They do what's called a click and go network, right? They can create private chains without the cost and complexity of building from scratch. Essentially, you start small and then move rapidly into production. So you could do your thing, start small, go do your proof of concept, go do your beta, then go do your full production relatively quickly. You can configure this your way, and you can have complete dashboards, which will make your doctor happy and your patient happy, right? And then because you have a full-featured API, you can really, really take control of your data, right? There's no limitations. There's nothing you can't get to in the Kaleido system. There's also some sample code that you can use, which is really kind of neat. So you can get some really good ideas on how to use blockchain as a service in healthcare. Now, Kaleido isn't just healthcare, but they really do kind of try to focus on that. And they kind of just did this really neat example that you can go to their website and check out. So the other thing I like about Kaleido too is that they've gone ahead and they've done their certification. So their platform is certified SOC 2, and that's important, right? 3 Service Trust, they're ISO certified. And then Kaleido is basically, they've got all the business controls and everything else. So they've gone to the trouble of getting certified. And just like IBM has, it's just neat seeing this in a smaller company. So it gives them a little bit more freedom to offer services in the healthcare space because they're already meeting some of the regulatory requirements that you're going to need to have under HIPAA. So in summary, there are some neat people in this space, but it's a space that's wide open, and there's a space where we still have issues with silos of medical records and how medical records will be shared. IBM is more focused on a producer to consumer of medical product, but it doesn't mean you can't go build your own system on their fabric. Cerner and Epic own a lot of the data in the backend systems, but it's haphazard, right? We don't know if they're going to be able to do blockchain or not. It doesn't seem to be on their roadmap, but it doesn't mean that something won't surprise us and they'll pop something out later on. Smaller companies like Kaleido have interesting ideas. They just need to get to critical mass. I really honestly think if something like Kaleido gets to that certain point of adoption and usage, you're going to see some really interesting changes in medical data record keeping that will solve some problems. We still need to solve for privacy, anonymity, security, and accuracy of the data. But those are technological problems, and those can be relatively solved relatively quickly if we get good regulation and we get good standards and we get good guidance from the federal regulatory bodies that we need to have, or we have a global standard that we can start working with. So again, healthcare and blockchain is really kind of interesting. There's a lot of savings we can do in terms of data and how data is used, managed, pulled, and shared. And it's just going to be really up to smaller companies, I think, and IBM and the adoption among more technologically agile health insurance companies and hospitals and other groups to actually really make this thing go. All right, that's my lecture for this one. I will see you in the next lecture. Thank you.